Hi, my name is Dr. Jackie, and doing this video today on wellness. My background is I've been a doctor over 30 decades, and right now, rightly mostly working in general practice, mostly adult treatment center, but I've had experiences in various fields. But today I'm just going to talk to you about kidneys. Somebody very close to me has had kidney illnesses, but I've always believed in looking for alternative ways of treatment. So, without further ado, I'll just talk about kidneys and basically um, try and teach what it's all about, and then take it from there. So, so why kidneys? Although we treat with medicine and everything, I wanted to know how we can use other, your lifestyle to help your diseases. But first of all, we'll just talk about what kidney illness is, and the various type of treatments that's available. I'll be reading from the screen, which is not the most effective, but we'll just take it from there. Right. What are kidneys? These are the pair of reddish brown bean-shaped organs, each roughly on the size of a fist. Yeah, it's located just below the elbow cage. Usually it's on each side of the spine, uh, uh, in the back of the abdomen. They are very crucial components of the urinary system, which includes the ureters, bladder, and urethra. Right. I don't know if you can see that, but you can Google that and see it. So the primary function of the kidneys is to filter blood, removing waste products, excess fluids to promote urine, while playing a vital role in maintaining overall body homeostasis. So, what is the structure of each kidney? I don't want to bore you with details, but each kidney is approximately 10 to 15 centimeters, about 4 to 5 inches long, and weighs about 40 to 190 grams, varying by gender and individual factors. So the right kidney is typically slightly lower. So your right kidney circles are slightly lower and smaller than the left one due to position of the liver. An adrenal gland sits on top of each kidney, producing hormones like cortisol, erythropoietin, renin, calciferol. That is the active form of vitamin D. So, what is a normal kidney? A normal kidney is characterized by the function, is characterized effectively by what is a normal kidney? This is when the kidney effectively filters waste products. So the kidney's main function is to filter waste products, excessive water from the blood, and maintaining a healthy balance of substances in the body, and not allowing significant amounts of protein to pass into the urine. Okay? So there's something called the glomerular filtration rate. That's something you need to know even when you're getting your kidney function. Nowadays, when you have your kidney function, that's automatically measured in everyone, because it's been that kidney functions has been, before people go into kidney failure, and it is diagnosed quite late. So what has happened is nowadays, whichever cause, it can be quiet until it's too late. So nowadays, if you do a blood test, immediately, usually associated with it is it's called glomerular filtration rate. So it will show us how effectively your kidney is functioning. So if any kidney disease is not picked up late for your treatment. So the glomerular filtration rate, it measures how well your glomeruli, yeah, glomeruli are just all this anatomy, the structures. You'll see them on the kidney itself. How well these tiny filters in the kidneys are cleaning the blood each minute. So GFR of 60 or higher is generally considered to be the normal range. In the normal range, this value is often estimated. That's why they call it estimated eGFR, using a blood test that measures creatinine level. Creatinine is one of the chemicals in the kidneys. Level in the excreted in the kidneys, along with other factors such as they consider your age, your weight, your height, and sex. So creatinine is a waste product from muscle wear and tear. If kidneys are not functioning properly, creatinine can build up in the blood. Some calculations for eGFR may also incorporate cystatin C levels. 1 second. Cystatin C levels. Let's move that on ahead. Next page. C protein less cystatin C level protein less affected by muscle waste. Age. On page 2. Age or diet, potentially offering a more accurate estimate. So what is urine? So the urine albumin. Urine albumin is a protein found in the blood. Healthy kidneys prevent albumin from passing into the urine. Therefore, a urine albumin results below 30 milligrams, or urine albumin creatinine ratio, we call UACR, below 30 milligrams per gram, is considered normal. The presence of albumin in the urine, especially above this threshold, can indicate kidney damage. So other indicators you need to know about your kidney. While the glomerular filtration rate and urine albumin are key, other tests and factors contribute to comprehensive assessment of kidney health. Blood pressure. Controlling blood pressure is crucial for kidney health. So, as high blood pressure can damage the kidneys. The smallest blood vessels are easily destroyed by hypertension or high blood pressure. So blood urea nitrogen, so they call it BUN. So the blood urea nitrogen, this blood test, that's another blood test that's done. What other things that are important for your kidney? So the blood urea nitrogen, BUN, this blood test measures the urea nitrogen and another waste product. Normal BUN levels typically range from 7 to 20 micrograms per deciliters, though this can vary with age and other health conditions. Elevated BUN, so blood urea nitrogen, can signal impaired kidney function. So this is one of the things you need to look for when your blood test for urine is being investigated. So serum creatinine, while used to calculate eGFR, the glomerular filtration rate, a standalone serum creatinine level can also indicate that your kidney function. It can also indicate give an indication about your kidney function. So normal levels of creatinine varies based on your sex, age, muscle mass. But generally a level more than 1.2 milligrams per deciliter for women and 1.4 milligrams per deciliter for men may suggest kidney issues. So regular testing for glomerular filtration rate and urine albumin is particularly important for individuals at higher risk of kidney disease, such as those with diabetes. I'm going to repeat that. So regular testing for your glomerular filtration rate, and I'm saying in the UK it's routine when you're having a renal function test. That's routinely done, and the urine albumin. Sometimes they take the two and measure it's particularly important for individuals at higher risk of kidney disease. What individuals are these ones? People with diabetes, high blood pressure, heart disease, or family history of kidney problems. Early detection allows for timely treatments to slow the progression of kidney disease and prevent complication. So early detection is quite important. So you may ask, what is kidney damage, or how is kidney function, how or what is kidney damage, or what is a diminished kidney function? Well, I'm glad you asked. So kidney damage or diminished kidney function, also known as kidney failure or renal failure. It occurs when one or both kidneys no longer function adequately on their own. This condition can be temporary and develop rapidly. Acute kidney injury. They call it acute kidney injury, or the AKA. That's usually the jargon that's used in hospital. We use in hospital. Or be a long-term issue that progressively worsens over time. So chronic kidney disease, chronic kidney disease, yeah. So when kidney fail, they cannot effectively filter waste products and excess fluid from the blood, leading to a buildup of toxins in the body that can be life-threatening without treatment. So, what damage can kidney failure do? Kidney failure, also known as renal failure or end-stage renal disease, ESRD, occurs when the kidneys can no longer adequately filter waste products from the blood, functioning at less than 15% of normal levels. This condition can lead to a wide range of severe health complications, affecting nearly every system in the body. Every system in the body. Kidney failure can cause excessive damage throughout the body due to the accumulation of waste products, like toxin buildups and imbalances in essential substances that the kidney normally regulate. The primary damages and complications associated with kidney failure include, let's start with cardiovascular system damage. Kidney failure significantly increases the risk of cardiovascular diseases, which are the leading cause of death in people with kidney disease, especially those on dialysis. We'll say that again. So kidney failure significantly increases the risk of cardiovascular disease. What is cardiovascular disease? Things to do with your heart, yeah. Which is the leading cause of death in people with kidney disease, especially those on dialysis. So, what kind of cardiovascular damage can you have? You can have heart disease and stroke. The heart has to pump harder to get blood to kidneys, leading to heart disease. Kidney failure can cause or worsen high blood pressure, which further strains the heart and blood vessels. High blood pressure, that is hypertension, can cause or worsen high blood pressure. Sorry. Let me say that again. Well, the reason I'm hesitating is because I'm thinking of patients that I've seen who have had kidney disease, and then I've seen the complications of what the kidney disease or kidney failure has done to them. So while I'm reading this, I'm also remembering the cases. So that's why I have a bit of, my brain just took me there. But I'll come back to what I was talking about. So the other cardiovascular system damage, we're saying that kidney failure can significantly increase the risk of cardiovascular diseases, which are the leading cause of death in people with kidney disease, especially those in dialysis. So what kind of cardiovascular diseases are we talking about? We're talking about heart disease and stroke. We're talking about high blood pressure like hypertension. We're talking about having fluids around the lungs like pleural effusion. We're talking about vascular calcification. Yeah? So, the slides you can see the details of what's that about. So blood pressure, this is when the kidneys fail and then they cannot effectively remove excess fluids and sodium, leading to fluid retention, elevated blood pressure, and this in turn can further damage the kidneys and other organs. And the other complications of cardiovascular system is fluid around the lungs, pleural effusion. Excessive fluid buildup can accumulate around the lungs, making breathing difficult. And the other complication could be vascular calcification. That is imbalances in calcium and phosphorus can lead to the hardening of blood vessels, increasing the risk of heart attacks and strokes. So what else can happen? You have blood and immune damage, blood and immune system damage. So you can have things like anemia. This is other complications. Anemia, that is, blood and immune system damage will include anemia, weakened immune system. That is, in anemia, that is when the kidneys fail to produce, they produce less erythropoietin. Erythropoietin is a hormone vital for red blood cells production. This leads to anemia, that is low iron levels, causing fatigue, weakness, and potentially heart damage. The other thing, it can weaken your immune system. Individuals with chronic kidney disease are more susceptible to infections and illnesses due to compromised immune response. So your immune system is very important. So the other system that is compromised is your bone and mineral metabolism damage. So bone and mineral metabolism damage, you can have bone disease like renal osteodystrophy. That way, this is secondary hyperparathyroidism and electrolyte imbalance. So what is bone disease? So bone disease, that is kidney failure disrupts the balance of your calcium, phosphorus, and vitamin D, leading to weak and brittle bones, increased fracture risk, and bone pain. And the other thing is secondary hyperparathyroidism. So what is this? This occurs when the potassium, I need to answer this for 1 minute. You were saying they also have a weakened immune system. So individuals with chronic kidney disease, CKD, are more susceptible to infections and illnesses due to a compromised immune response. Yeah. And just to repeat again, I think we already talked about bone and mineral metabolism damage. So bone disease, they're prone to have bone disease or renal osteodystrophy. We say that kidney failure disrupts the balance of calcium, phosphorus, and vitamin D, leading to weak and brittle bones, an increased fracture risk, and bone pain. So the other thing is they can have secondary hyperparathyroidism, which is SHPT. This occurs when the parathyroid gland becomes overactive in response to low calcium and high phosphorus levels, contributing to bone damage. Yeah, and the other thing is electrolyte imbalances. So the kidney regulates electrolytes like your potassium and phosphorus. So failure can lead to dangerously high potassium, hyperkalemia, which can cause abnormal heart rhythms and muscle paralysis, and high phosphorus, hyperphosphatemia is called, which can contribute to bone and cardiovascular problems. So the other complications of kidney disease is neurological and cognitive damage. So you can have brain fog and confusion. The buildup of waste products such as urea can affect brain function, leading to confusion, difficulty concentrating, and memory problems. So nerve damage you can have also nerve damage. Kidney failure can cause nerve damage like neuropathy, leading to numbness, tingling, and pain in extremities. It can also lead to uremia. Uremia is a severe buildup of waste products in the blood, and can cause symptoms like fatigue, nausea, restless legs, and sleep disturbances. So the other thing is it can also cause cognitive impairment and stroke. People with end-stage kidney disease are at a higher risk of cognitive impairment, dementia, and various types of strokes. Okay. And other systemic damages can happen, like gout. You can have gout, high levels of uric acid, which the kidney, which the kidneys normally filter can accumulate in the blood, leading to gout and a type of arthritis causing joint pain and swelling. So the other thing, you can have metabolic acidosis. Metabolic acidosis, that means that the kidney the kidney helps the body's acid-base balance. So failure can lead to an excess of acid in the body, which can worsen kidney disease and contribute to bone and muscle loss. Okay, I'm trying to keep this video short, so I was looking at my time. I have a prompt, so I have about 9 minutes to finish. So we've talked about other systemic damage. So we can have gout, which is high uric levels, which the kidney normally filters, and it can accumulate in the blood, leading to gout. A type of arthritis causing joint pains and swelling. Yeah, so if you have joint pains when you have kidney problems, it could be from gout. So then normally your doctor will check your uric acid. Metabolic acidosis, why is that? Because the kidney is so important in helping our acid-base balance. So failure can lead to excess of acid in the body, which can worsen the kidney disease and contribute to bone and muscle loss. So the other thing you can have is skin problems. Skin problems like dry, itchy skin, pruritus is a common and distressing symptoms of kidney failure, often more severe in those on dialysis. You can also have GI gastrointestinal symptoms like nausea, vomiting, loss of appetite, and a metabolic taste in the mouth are common due to waste product accumulation. You can have muscle cramps and weakness. Electrolyte imbalances and nerve damage can cause muscle cramps and general weaknesses. So the treatment usually people opt to is dialysis. We can ask why dialysis. So different types of treatment, but one of the treatments when you have kidney failure is dialysis. So let's see, why do you have dialysis? So dialysis there are two types of dialysis. Especially when there's kidney failure. The primary reason for dialysis is kidney failure, also known as end-stage renal disease, ESRD. This means the kidney has lost the ability to filter waste and excess fluids from the blood. So what happens then? There's buildup of toxins. When the kidneys fail, waste products like urea, creatinine, and excess fluids accumulate in the bloodstream, leading to a condition called uremia. So this can cause various health problems, as we mentioned above, and if left untreated, it can be fatal. So that's where dialysis comes in. And then acute versus chronic kidney disease. Dialysis can be used for both acute kidney disease, aka acute kidney injury, or where the kidney function declines rapidly, and chronic kidney disease, CKD, when kidney function gradually deteriorates. In acute kidney injury, dialysis may be temporary, while in chronic kidney disease, it is often a long-term treatment or a bridge to a kidney transplant. So effectiveness and impact. So hemodialysis, how it works. So in hemodialysis, it uses a machine like a dialyzer to filter the blood outside the body. The body is drawn from the patient and passes through the dialyzer, which removes waste and excess fluid, and then return to the body. Access. To facilitate hemodialysis, a vascular access is created in the arm. Yeah, this can be in arteriovenous, they call it arteriovenous AV fistula, connecting an artery and a vein, or an AV graft. It's using a synthetic tube to connect an artery and a vein. A temporary catheter may be used initially. So frequency. Hemodialysis is typically performed 3 times a week, with each session lasting about 3 to 4 hours. Location. Hemodialysis is usually done in a dialysis center, but it can also be done at home. So the other type of dialysis is peritoneal dialysis. Here is how it works. Peritoneal dialysis is using the lining of the abdomen, that is the peritoneum, as a natural filter. A special fluid is called dialysate, is introduced into the peritoneal cavity, where it absorbs waste and excess fluid from the blood vessels in the abdomen. The fluid is then drained out. Access. A catheter is surgically implanted into the abdomen to allow the dialyte to flow in and out. So there are 2 types. There's the continuous ambulatory peritoneal dialysis, CAPD. This is done manually and exchanges of dialysate several times a day. And then there's an automated peritoneal dialysis. This uses a machine, it's called a cycler, to perform exchanges typically overnight while the patient sleeps. So frequency of dialysis is usually done, peritoneal dialysis is usually done daily. So other considerations. So life-saving treatment, dialysis is a life-saving treatment for kidney failure. So it help remove waste products and excess fluids from the blood. It's not a cure. It's important to note that dialysis is not a cure for kidney failure. It manages the condition. So quality of life. While dialysis can significantly impact a person's life, many people on dialysis can still live active lives, including working, raising families, and traveling. So life expectancy. Life expectancy on dialysis actually varies, depending on several factors, including your age, overall health, and the cause of the kidney failure. So the question we need to ask ourselves, can kidney function be improved or restored? I think we'll talk about that in the next video. We'll talk about whether it can be improved or restored, and we because I'm trying to keep this to at least not more than 30 minutes each. So I hope that you found this useful, and this is Dr. Jackie from Health, Wellness and Beauty channel. So I hope to see you in the next video. Thank you for listening to this, and please give it a thumb up, and if as you watch, and subscribe to the channel. Thank you.